BTK inhibitors are really now a standard backbone treatment for patients with chronic lymphocytic leukemia. There are now 2 approved BTK agents that differ in terms of their safety profile. In terms of comparative efficacy, we don't know. That would require cross-trial comparisons. And there actually is a randomized phase 3 study ongoing comparing acalabrutinib to ibrutinib. And that probably still has a ways to go to read out, but that will give us our most clean look at the comparative safety and efficacy. Qualitatively, though, I think that you can make some inferences already. Acalabrutinib, when individuals start the medication, about a third of patients will have a headache. That headache tends to be relatively self-limited, easily controlled by good hydration. Sometimes caffeine can help, acetaminophen or ibuprofen if necessary. The main thing is to let patients know that it can happen and that it generally resolves after a day or two, and that it doesn't persist. I think patients, if they had this headache that lasted a long time, would be more apprehensive, but because this is short-lived, simply preparing them for that can be helpful. I think it's the opinion of a number of people who've worked with both medications that acalabrutinib appears to have lower rates of arthralgias. There is bruising and bleeding with all BTK inhibitors, but the rates of severe, clinically significant hemorrhage tend to be really quite low, in the low single digits. The bigger issue that also is of significant consideration is the acquisition of hypertension and development of atrial fibrillation. It appears in the Elevate-TN study that the rates of atrial fibrillation are quite low, sort of 3 to 4% range, and only just slightly above the control arm. So that appears to be something that may differentiate it from ibrutinib. Similarly, the rates of hypertension were pretty low, and it wasn't clear that there was even really a hypertension signal from acalabrutinib. So those patients who might have any sort of cardiac history, that might be a reason to pick acalabrutinib over ibrutinib. Conversely, acalabrutinib appears to be more affected by proton pump inhibition, and so if a patient's on acid suppression, that might be a reason to pick ibrutinib over acalabrutinib.